connection issues, but I work with Dr. Banta at the Directorate of Force Health Protection at DND, Department of National Defense. Our team works on policy, and we answer questions on occupational and environmental health questions that come in from the field. So about 10 years ago, Dr. Banta and our team were concerned about the inhalation exposures of our CAF members. So CAF is Canadian Armed Forces members when assisting provincial and territorial wildland fires. So we established a new health protection recommendations, and we've been updating that every few years as new science comes in the goal, obviously, to protect our wildland firefighters. So if you could advance the slide, please. Okay, so what is Operation Lentis is our domestic response to disasters. So one of those is obviously wildland firefighting, where we are involved in different types of activities. So specifically type 3 or mop-up work, which includes doing kind of the mop-up, putting out the smoldering flames, going around, could be patrols, could be moving equipment, working on basically wildfires that are under control, but at the mop-up stage. So we do work alongside our provincial and territorial counterparts. So some key deployments. So this slide is really from 2024. Last year we had 120 CAF members at the Jasper fire, relieved by reservists, and then the SEMO fire, about 110 CAF members doing type 3 work. So that'd be Northern Alberta. So as one of the presenters mentioned earlier, that we had a much larger wildfire impact on burning in 2023. Last year was about a third of that, and it seems like this year is another bad year. So if you could advance the slide, please. So I think everyone's probably aware, since there's been a few slides related to this, but we have this is from June 2nd, various hotspots, various wildfires across the country, more so in the mid and western provinces. One thing that we had to look at when looking at the cross country is the different types of biomasses that may burn from different areas. So those biomasses may give off slightly different, basically, emissions, generating different concentrations of some key contaminants. Advance the slide, please. So what is the goal? Well, that's obviously to help protect the health of the CAF personnel during wildland firefighting. So I'm the industrial hygienist, so some key IH challenges and maybe overall challenges as well. So we know that smoke emissions, they're hard to measure. They're hard to measure in the field, really. We know some of the key drivers would be formaldehyde, acrolein, resveratrol, PM, and now benzene with a lower threshold limit value. They really drive a lot of the respirator use, but it's impractical to measure these in the field due to various logistical challenges. Battery charging, all these things for IH sampling is pretty tough. So that's one thing we have to overcome. Another is, when do we actually put on a respirator? So we looked at, can we have a science-based but field actionable trigger that would give us some guidance for APR use? And the last, or one of the other main ones would be, yeah, that's fine to have protection against PM and some of the volatiles, but what about carbon monoxide? So we know that these APRs, unless you're wearing supplied air, they're not going to protect against carbon monoxide. So can we make a guidance that is protecting the CAF from carbon monoxide, but is actually operationally feasible? Next slide, please. So looking at some of the literature out there, there are regression models that you can predict the concentration of these contaminants mentioned based on carbon monoxide concentration. So that's kind of the basis of our tiered approach. But certain things we had to take into account. So what we're trying to do is come up with an actual parts per million of carbon monoxide that you would don a respirator to be protective of these other chemicals. So what do we need to take into account? Well, you need to think about the combined effects of these irritants. So formaldehyde, acrolein, respirable PM, and then through an equation like we use in industrial hygiene, kind of an additive thing where we have to keep the equivalent exposure index below 1. So that was the first goal. Another goal is to look at these individual contaminants and keep their individual threshold limit values. Those are basically the limits that we legally need to keep the troops below. We have a 50% of that for conservatism, so that's what we're going to try to hit. And next, that's okay, but can we have exposure, or do we have enough data from across Canada that we could be comfortable to cover all the biomasses because of the slight differences? So it turns out yes, with one exception, where grass and peat. We do know that through looking at different emissions factors that there are higher formaldehyde and some other chemicals there. So our model kind of, we have to be a bit conservative there, and I'll show you that in a minute. So the result is that it's 6 ppm. It's when we don a respirator, but that's a sustained exposure, which our policy does address. Okay, yeah, go ahead. And we wanted to mention that also this is protective for benzene. The benzene TLV did drop about 25 times, I think about 2 years ago, and through a regression model. So that orange line there is actually the TLV, but we're doing a 50% action limit of that. So at 0.01, that lines up to about 6 ppm. So at 6 ppm, we can be, based on all the information we have, personal exposure data review, this is a number where if we don respirator protection, we can actually protect against those contaminants. Okay, next slide, please. And then obviously we have carbon monoxide because our respirator won't protect against that. When I talk about respirator, I mean multi-gas. So our policy is that for sustained exposures above 21 that you back away. The 21 comes from, well, the TLV is 25 from the ACGH, but that is altitude and workload adjusted through some literature reviews that's kind of common for wildland firefighting. We do expect short-term spikes to exceed 21 ppm. Our goal is not to back away if you see these spikes, but it's more of a longer-term exposure, which we address in our policy. We do understand that there are definitely operational needs and risks, or our policy addresses operational needs and also has some risk management flexibility, which is absolutely crucial for implementation for the CAF. We do want to say that it does respect this is an industrial hygiene thing, but 5 times the TLV for an average over 15 minutes, that's 104 ppm. That's kind of when you need to go away if we are exceeding that. Also, visual assessment of smoke is always considered, and that's built into our policy. And we do provide a carbon monoxide field guide to try to help implement such monitoring. So I think I have one more slide, the next one. So this is a table from our policy. So this is the tiered approach. What I have not yet mentioned is that we will always use the AQHI, which is important if that data is available, and also visual assessment of smoke, and also if there are disturbance activities like disturbing soil or ash. We know that those do generate exposures, especially silica. So in the green tier, if those are low or medium and you have less than 6 ppm CO, you don't need to wear a respirator. Of course, sensitive individuals may choose to wear an N95 at their choice. The caveat is if you're dealing specifically with a grass or peat fire, even in low intensity smoke, we do recommend a APR. And then in the yellow tier, this is where you get a little bit more smoke, or you have AQHI numbers that are higher, very high. And then you're kind of in the 6 to 21 ppm of CO, we recommend that the wildland firefighter do don that multi-gas respirator. And then finally, very heavy smoke, sustained exposure over 21 ppm. That's when the firefighter needs to move to cleaner air. I tried to do that fairly quickly, so we have enough time for the second part. So over to you, Dr. Banta.
Great job.
If you could make it just a few minutes, that'd be ideal. Thanks.
Very good. I'll try to be quick. Greg, you did a great job outlining that. And again, just in response to Rick Dunning's comments, the whole point of our policy has always been to try to give the most flexibility to the firefighters in the field, that they would be best to use it when the CO levels are high, to try to mitigate the most severe exposures that would observe then our regulatory obligations, but protect their health as well, and to minimize using respirators that are uncomfortable, sweaty, move around on their face, or they feel hot in them. So we're trying to, how should I say, take the worst exposure and control it when when they're at most risk. So when we've reviewed our policy this year in 2024, we looked at a systematic review by West. And again, that documents exposures to the multiple compounds of potential concern that are, key contaminants that can be above action levels in TOVs. And, this is why we place importance on the respiratory protection with APRs to mitigate the risk associated with those inhalational exposures. And as Greg mentioned, we gave sort of additional in the field guidance about how to not necessarily to see that the CO exposures are sustained before you make changes, and that a little blip doesn't necessarily mean that you have to make big changes. Now, if you look at the short-term acute conditions that take firefighters out, it's hard events. And so part of the essence of our policy is to try to mitigate CO2 toxicity, and even low levels of exposure to CO can lower angina thresholds in those with subclinical coronary artery disease. So that's really important. It's really a bad toxin and can have negative effects on the cardiovascular system. And as Greg already said, we are also trying to limit the mixed irritant exposures with the use of the multi-gas APRs. And we also see benzene as a key contaminant. And again, we want to keep the exposures below action levels. And so this is all, we're trying to cover the worst items off in smoke and protect the health of the firefighters. Next slide, please. So I'm not, in the interest of time, I'm not going to go over the health effects. We've heard from, the experts, Dr. Matz, Dr. Madden, and Dr. Cherry and her team. Excellent work with Dr. Cherry and her team, documenting some of the newest and evolving, longer-term data on the health effects of the respiratory health effects to wildland firefighters. So that's great work. I won't go over that, but I'll just acknowledge it in passing. We'll go to the next slide. And again, yes, as we say, benzene is a key driver. Benzene has known adverse effects on the blood system. And so it is important, we think, to protect against it. This study in 2023 from Navarro showed that personal air levels of benzene were highest on day one when they used chainsaws a lot and when smoke levels were lowest. And the levels got up to about three-quarters of the TLV as a geometric mean. And it showed that the exposures varied, with about a quarter of the crew being exposed to much higher levels. And in essence, what we thought is that benzene exposures to wildland firefighters, from the grass, brush, and mixed conifer biomass that was the biomass in this study, it was confounded by the petroleum exposures. And so that's why in our HPR, we advise the use of respirators when they're refueling chainsaws, especially when they're warm, where there's a lot of vapors that could be created. Next slide. Excuse me. Now, this year's review also included an article that highlighted the challenges of respiratory protection. We've heard about that from everybody here. It's very impractical to use SCBA. It does have to be considered, though, in WI fires. As Dr. Cherry found, there were people who had long-term adverse lung effects, and that was a mixed, WI and wildland fire with mixed emissions from those two types of sources. And There was, we've heard from lots of people today about respiratory protection. Rick Dunning did alert our shop about the National Urban Security Technology Laboratory have actually constructed a prototype that does meet the NFPA 1982 Wildland Firefighters standard. It's a prototype. They even looked at user uptake and so on. What we understood is that it was being forwarded for formal testing by NIOSH. We haven't heard back about that, but of course, what we're seeing is that over time, the TLVs are dropping. It's getting harder and harder to protect people. So we really do need a technological advance. And we see that as hopefully an avenue for the future. Next slide. Our respiratory medical surveillance takes into account Health Canada policy, and we emphasize the importance of baseline spirometry and entry, and those who have who we say are regularly exposed, where they're getting exposures above the 6 ppm carbon monoxide as a 8-hour TLV, because that does correlate, with the higher exposures, and they have to have more than 50 hours in 30 days to qualify as a regularly exposed person to get that medical surveillance. And of course, there's also periodic spirometry with periodic health assessments every 5 years, less than 40, and every 2 years if they're greater than 40. And also spirometry for anybody who has symptoms or exceptional exposures. Next slide, please. And for those that are regularly exposed by the CO measurements, where we can infer that their benzene exposures are above the action level, we would also recommend that they get blood counts, CBCs, and that would be best done about 6 to 12 months after the firefighting season. But we don't recommend urine testing, what we call a biological exposure index testing, because the number that is cited in the ACGH TLV booklet hasn't been updated with the new TLV. So at this point, we're not recommending that. Next slide. And that's it. So we'll answer questions when there's time, I guess. Thanks for your attention.
Thanks.